We're working with South West London Pathology to bring samples from the Nelson Health Centre in Merton across to St George's Hospital. I'm Dr. Sabina Mughal, I'm the consultant paediatrician and I'm Director of Healthcare Partnerships here at Apian. So this isn't just a one-off route for drones, this is actually us building a network of logistics infrastructure in order to support the NHS services across this entire area. We're using physical AI to ensure that clinicians can focus on their patients rather than having time taken away on administrative tasks that clutter up their day.
I'm Simon Brewer, I'm the Managing Director of South West London Pathology. We're a large network of pathology laboratories in South West London. We serve a population of about 1.8 million. We do about 51 million tests a year. We cover 5 sites and the largest of those is here at St George's. We serve nearly 400 GP practices and we have a fleet of vehicles that go between those every single day. As with most things in London, we have a major problem with congestion, and so we were very keen to look for a solution to that problem because it takes so much time to be able to transfer samples from site to site. So we were keen to look for a partner, which we found in Apian, supported with Wing. For the NHS, it is 23% more cost effective than our vehicle equivalents. We look forward to the time when we're able to extend this flight from Kingston to Croydon, from Epsom and St Helier, from our new GP Hub Lab in Mitcham Common, and then also look at the expansion of that into other robotics and automation that can help us make sure the end-to-end time is as fast as possible.
What does this mean for patients? This means they can expect faster test results and being able to get their care closer to home in the community, which aligns with what the NHS is trying to do for all of our communities and our patients. As a paediatrician, when I think about my populations that I serve, a lot of children are having increasing respiratory illnesses, intensive care admissions and even deaths as a result of pollution. The NHS is currently responsible for 4% of the country's carbon footprint. We can bring this down by bringing down our carbon emissions for logistics transports by 98%, and being able to cut down that pollution really comes back to the heart of what I'm doing for the NHS. So this is an example of how we are reducing worry for families and bringing better clinical outcomes in a shorter span of time.
My name's Art. I'm a phlebotomist with St George's Hospital here at the Nelson Centre. My main experience of the drone has been the speed, the certainty that critical tests can be got to the lab almost immediately. Benefits for patients are that they know that whatever test has been requested, including ones that have to be got to the lab very quickly, they can have done here. In the past, sometimes they've had to make another appointment at St George's, which can be very inconvenient.
So at the Nelson, we've got a variety of different services. The drone has been a really good initiative. It's one which CHP really embraced. I think this is a starting point and we would welcome the opportunity across all of our other assets.
We're honoured to partner with the NHS and Apian to bring a more efficient way of transporting pathology samples. Expanding our service to South West London is an important moment in bringing this technology to more areas across the UK. In just the first few months operating at St George's, we've delivered samples for thousands of patients, reducing transport time by 85% and enabled faster processing for the NHS. We've been working in this space for more than a decade, really perfecting the technology and making sure that it is safe, it's reliable, and it's efficient. So we've already done well over 1 million commercial deliveries, and we're just continuing to grow.
South West London Pathology has been an incredible innovation partner. They see this drone network as a key part of their modernisation agenda, and it's working with partners like this that we can really bring the biggest difference to the NHS and the people it serves.